Welcome to Detroit Public Safety Headquarters. We'd like to welcome you to this very important press conference today to talk about our CIT training and why it's so important to our community as well as our department. And with that, I'd like to introduce Chief James E. White.
Thank you, Captain Gilbert, and good morning, everyone. And thank you for being here. Today is a very exciting day for the Detroit Police Department. I'm happy to announce this program that we are now taking department-wide. Give you a little context of what we're dealing with. The Detroit Police Department responds to approximately 4,000 runs per year for people dealing with some form of mental health crisis. That's about 21 runs on average a day. As recent as yesterday, we had a citizen in crisis who barricaded herself in her apartment complex, threatened to burn the apartment complex down. Just a very tragic situation. And thankfully, we were able to take her into custody without harm, without injury, and she is now getting the services that she so desperately needs. Sadly, in the United States, there are 30 million people in some form of mental health crisis or suffering from some form of mental health crisis. And that's whether it's diagnosed or not diagnosed, there are people that are suffering in this country with mental illness. And unfortunately, we recognize, and the statistics and the data supports this, that minorities and children are impacted, and they don't necessarily get the services that are needed. There are a number of reasons that happens. Oftentimes, the stigma associated with mental crisis and seeking mental health services, people tend to not, in that particular demographic, tend to not reach out and get those much needed services. And the unfortunate reality, particularly in law enforcement, is that is what drives that pipeline, from school to prison. A lot of times people are suffering in silence. They're unable to really process or comprehend a lot of what's happening to them. They act out in many different ways, and usually that results in some police intervention. This is a disease that victimizes our community, plain and simple. We see it day in and day out. We see it in impulsive decision-making. We see people making long-term decisions for short-term problems, conflict resolution, people making decisions to bring a gun to situations to resolve relatively simple conflict. You bumped into me, you bumped my car, you cut me off in traffic, and so now I'm going to use a weapon to resolve that matter. When you see that, it doesn't take a psychiatrist or a mental health professional to recognize that if that is your decision tree, or if that's the metric that you use to resolve conflict, that likely there is an issue with mental illness. So again, this is a crisis that really impacts our community. We cannot arrest our way through mental illness. We cannot, arrest you for committing those types of acts, and things simply putting you in the judicial system will resolve that problem. So this program is exciting because it gives our officers additional tools. Under Chief Craig, he rolled it out. I worked under him with the program, and we were able to launch it in 1 or 2 precincts, I believe. Now, I'm very, very happy to announce that this is a program that we're taking citywide with the captain's direction and her team. And I apologize, I don't have everybody's name, but these are the folks behind me that are doing the great work. Director Reed Wilson, who is driving it from a data analytics standpoint. We are just super excited to bring this tool to our community and partner with the DWIHN Integrated Health Network and the Housing and Revitalization Department. We're just, as I said, we can't be happier to be here today and bring this tool. This is going to de-escalate a lot of those situations. It's going to support our officers. It's going to keep our community safe. It's going to keep our officers safe. And it's going to get those folks who are in need of mental health support the support that they need without putting them necessarily in the judicial system and re-victimizing someone who's already a victim of mental illness. So with that, I'd like to invite, I believe, my partner up, Mr. Doeh. I hope you were prepared to speak, but I'm going to turn it over to you now, sir.
Thank you so much, Chief White. You know, Chief White and I go way back, and it's so refreshing to know that leadership matters. And he's always been the person who he is, you know, one who speaks from the heart, who's very direct, and just knows how to build those bridges, link them together. And certainly this is what we have here. How extraordinary law enforcement, you know, meshing with the DWIHN Integrated Health Network. I mean, it's not often that you see, you know, the mental health side of things and law enforcement coming together. You know, last summer was a tough summer, and some of the folks that we serve coming into contact with law enforcement were not always the most positive of situations. And when former Chief Craig reached out along with the city of Detroit, Mayor Duggan, it became apparently clear that, you know, we could venture in such a wonderful partnership. And I tell you, it started off rough, but, you know, good thing there are folks a whole lot smarter than I am. You know, talked about Reed and Andrea Smith, and certainly folks at the city level, you know, who were just extraordinary in making this happen. This hasn't been all of a sudden. It's been just tenacious work and dedication. But I tip my hat off to those folks who are embedded within the dispatch center, folks who are embedded, you know, with patrol officers, clinicians who go along on those rides to make sure that we're responding to those calls to link people to services, because that's what matters. When we talk about some stats here, I mean, there are 75% of folks with mental illness go untreated. Within Detroit alone, we serve over 40,000 folks. Within Wayne County, period, 75,000 folks that we provide services to. This is extraordinary. And when you look at a population of 1.7 million people in Wayne County, obviously, you know, there are many more folks that we can reach. And if COVID has taught us anything whatsoever, is the fact that, you know, folks are experiencing some tough times, and it's not only refreshing, but it's absolutely amazing to know that there are organizations like our organization and DPD that is willing to help. I tell folks all the time within our organization, I don't want us to be that best kept secret. We're not a restaurant that has that great pasta dish. You know, we are that entity that comes forward when people are in need, and we want to do that. So, you know, I certainly thank the men and women of the Detroit Police Department. I tell you, there are some folks in this department here, one of whom is right behind me, in Captain Leonard. I mean, how you have not seen this woman in action. I mean, just the way that she's able to bring people together, she's able to soothe things, and I just like, wow, man, that's pretty awesome that she's able to do that. But I don't say that, you know, with a sense of admiration. I say that because it's not only her job, it is her character. And so for all those folks who do such an extraordinary job, CIT, Chief, for you to make this something throughout your, you know, force, throughout your department, I thank you so much for doing so. So on behalf of our board, our staff, all the folks who do some extraordinary work at Detroit Wayne, thank you so much for this wonderful partnership and opportunity. So unlike the Baptist preacher, I think I've reached my point, so I'm going to step back here.
Thank you, Chief, so much, and thank you, Mr. Doeh, for those wonderful words. As you've heard so far, this is definitely a very important initiative for our community and for our department. So much so that we've brought some of our partners that work with us that help to make the CIT program successful within the Detroit Police Department. And so I'll tell you a little bit about our mental health co-response partnership. It's a three-prong approach. We have a CIT 98 car, which is our mental health co-response car, which has a behavioral health specialist that's embedded within the vehicle, along with 2 crisis intervention team trained officers, which we call CIT officers. They respond to calls that are of a nonviolent mental health nexus. Very, very excited about that. This is pioneering and grateful for the opportunity. We also have the 911 behavioral health embedded specialist that's in our 911 call center. That's been going very successful, and later you'll hear from one of our specialists that operates there. And then our third prong is the Detroit Homeless Outreach, which is our DHOT, and we have clinicians and specialists that go out, advocates that deal with our unsheltered population, our most endangered members of our community, to help to provide them services and linkages to resources, along with our neighborhood police officers. To date, happy to report that within the Detroit Police Department, we have 98 members that have been trained throughout our agency that are crisis intervention team trained. Everyone that is a part of our program is trained through the International CIT training program, which is offered from DWIHN Integrated Health Network, and so excited that they would partner with us to give us that training, to give us additional resources for our agency, as well as the help that we need in our community. To tell you a little bit more about our CIT and kind of put it more in context, I'm going to introduce Officer Marcus Harris, who can give you a little bit more about our CIT training, as well as a success story that he's experienced.
Thank you, Captain Leonard Gilbert. Good morning. My name is Officer Marcus Harris II. I'm part of the Mental Health Co-Response Partnership Team, as well as a Crisis Intervention Team officer and instructor as well. This is a great training. I appreciate the training. This training is one of the best trainings I have taken on the department. One of the best. We have the best team as well with the DWIHN Integrated Health Network. And prior to this training, I would have known any resources or any knowledge of how to de-escalate a situation when you come in contact with people that's in mental crisis, or the resources we have in the Wayne County area. So my success story I had is I had an encounter with a citizen that was going through a crisis. An officer initially called me and said, "Hey, I need your assistance with dealing with somebody that's in a crisis right now." Made the location, gained knowledge from the officer, and after I gained the knowledge from the officer what was going on, I built a relationship with the citizen. But using my CIT techniques that I was taught in the training, I was able to de-escalate the situation with the individual and actually provide her with linkage to providers that we have within the Wayne County area. She was happy to hear about the providers that we have, and I was able to call our CIT card to the location, as well as the behavioral specialist, to help provide more resources to the individuals that was going through the crisis. Periodically, over the past couple of weeks, I did follow-ups with the behavioral facilities to make sure that the person is getting the proper treatment and proper care that the person needs. After several follow-ups, I was notified that the person is doing much better. She's getting the proper help. She's getting the proper treatment. And I'm so happy to be part of this team. I'm so happy to be part of CIT. And I appreciate DPD for having this training and to provide officers with a great knowledge of training. Thank you.
I just want to add to Officer Harris' comments, and I want the community to know that this team is so passionate about this work. Officer Harris and I, we kind of started on the CIT role together, and he's been doing all the heavy lift and the hard work. I left the department for a little while, but as a person who is a mental health therapist myself, it is heartwarming, and I know that's, some may think that's a bit overstated, but when you see the work that Ms. Burns and Officer Hernandez, Captain here, Leonard Gilbert, Director Doeh, Ms. Smith, who's not here, but constantly working, not just because of this program. There's a whole lot of stuff behind the scenes that happens on a day in and day out basis to support our community and to get to the moment that we are right now. So you will feel this program, you will see this program, and this program is absolutely going to save lives. It's going to save people. It's going to help people that are in crisis that don't need to be put in the judicial system or criminal justice system, but taken to a hospital and given the services that they need. Real quick, so Officer Harris talked about de-escalation. One of the key components in CIT is there's no clock on the work. So you're not pushed by the fact that you got to get to the next run. You're there to provide the de-escalation and the services that the citizen needs so that they can survive the crisis moment that they're in, because depending on which crisis that they're in, they will go through ebbs and flows in that moment. When you look at what Ms. Burns is going to talk about, the work that's happening in communications, the important component to that is there is work being done now before the officer even arrives to the police run. Very important stuff. So with that, I'm going to turn it back over to you. Thank you for letting me jump in there.
Thank you, Chief. So with that, we'd like to also introduce Ms. Tanitra Burns. She's a senior specialist with DWIHN Integrated Health Network. She is embedded within our 911 call center. She'll give you a little bit more perspective on that and the great work that she does there.
Thank you, Captain Leonard. Good morning. I am Tanitra Burns, and I am a clinical specialist with DWIHN Integrated Health Network, and I'm also a behavioral health specialist that's embedded within the Detroit Police 911 Communications Center. I would like to say through this partnership, we are better able to connect individuals to the services needed. We are also able to ensure that follow-up takes place in the appropriate manner through this greater coordination and collaboration. And it starts at the 911 center. So we're there to assist call takers when it has been identified that an individual is in a mental health crisis. I also have an example of a recent success story. The co-response team at Precinct 4 encountered an individual that presented in a mental health crisis. Treatment re-engagement began immediately. The co-response clinician reached out to us at DWIHN, and we were able to assist with coordination of care. Without the strategic efforts of our co-response team, the individual may not have been able to verbalize their treatment needs, thus continuing to experience a mental health crisis. I'm very excited to be a part of this movement. This increases the reach to help those with behavioral health needs. Thank you.
Thank you, Ms. Burns. So as you can hear so far, the passion that each of us have for being a part of this program. With that, I'd also like to introduce Officer Brenda Hernandez from our 4th Precinct to share her experience and how it's helped her with her role every day as an officer with the Detroit Police Department and in the community.
Thank you. Good morning. I am so excited to be here today. I joined the department to serve all citizens, and so when this training came available to me, I signed up immediately, got in the training, and continued to be excited. I was able to embrace the mental health professionals in our area, in our community, that are working so hard to do outreach. And I'm just so happy to be a bridge and a form of line of communication between those professionals and the citizens that are asking for our help. Not only have I been of assistance to citizens, but my peers, other police officers, have called me to scenes and said, Officer Hernandez, is there anything that you can offer? And we've been able to do that follow-up care. I feel so happy to be able to be supportive of other police officers, and I encourage those that are interested to take the training and be able to be just as excited as me about this program. I really look forward to its future. Thank you.
Thank you, Officer Hernandez. So again, we are very excited. As the Chief said and Mr. Doeh, there are so many people to thank. We don't do it alone. I don't have all my partners up here, but I'd like to thank Director Reed Wilson, along with my other partner, Director Andrea Smith from DWIHN Integrated Health Network. We work together to make sure that this program is successful under the Chief's leadership and Mr. Doeh. So we're grateful for the opportunity to be able to bring this to our community and our department. We endeavor to continue this great work. We have to thank the Hudson Weber and Flynn Foundation for their generous donation to our program. It has allowed us, as you heard from the Chief, our intent is to expand citywide throughout all of our precincts within the Detroit Police Department. And this donation has allowed us to be able to announce that we will be expanding into the 12th precinct. And we brought Commander Warboys here, and you'll hear from him and his excitement and appreciation about it expanding to the 12th precinct. Commander.
Thank you, Captain. Good morning. I'm Commander Kurt Warboys of the 12th Precinct. I'm here this morning to tell you how excited we are at number 12 to have launched the operation of a CIT car within our precinct. We respond to a large volume of calls, as the Chief mentioned. Many of these calls are for situations where a person with mental illness is experiencing some sort of crisis. Frequently, no crime has been committed, but both the party that made the 911 call and the person in crisis are still in need of help. Adding a CIT car to our patrol function will give the officers in number 12 another tool and greater options for providing services to people with mental illness. The team will help officers understand and recognize the signs and symptoms of mental illness and identify crisis situations. They will improve the safety for both citizens and the officers by deploying new de-escalation techniques for people in crisis. We will bring the ability to utilize resources and diversion strategies, providing assistance to those in need. And finally, the CIT car will help keep the other patrol units available to focus on crime and community initiatives, improving the safety and livability of the area. We are looking forward to seeing the positive effects of the CIT program in the near future and the benefits that it will provide the 12th Precinct community. Thank you.
Thank you so much, Commander Warboys. And with that, I'd like to reintroduce Chief James White for closing remarks and any Q&A you may have.
I think I've just about covered everything, so I'll just say if there's anyone in the community that is in crisis, that needs assistance, that we just ask that you reach out to Detroit Wayne Mental Health Authority or Detroit Wayne Integrated Health Network to get those services that you need. And with that, I'll take any questions.
Anyone with questions, just step up to the mic. You come up to the mic, Shirley. Yep.
Thanks for your time, Chief. Good to see you. Thanks for everyone's time today. Can you walk us through, Chief, exactly how it works?
Well, I'm going to let the captain walk you through that, and she can take you through the processes of how we would involve a CIT car.
Yes, sir. So as I stated, we have a mental health co-response vehicle that's staffed by a behavioral health specialist along with crisis intervention team trained officers. And so what happens is the call comes in for service to our 911 communication call center. With that, the call takers take the call. We have a behavioral specialist that's embedded within the communication center. That call is able to be transferred to that specialist. They're able to assess the call, determine whether or not a CIT car should be dispatched to that location, or if there's additional linkages to services or resources that may be needed. Then at that time, if that's determined, it would be given to our dispatch if a car should be dispatched, and then the car would be dispatched to that call area. The car would respond, and the officers would assess the situation, engage, find out what's going on, and then the behavioral specialist would be able to speak with the person, determine what the crisis is, what the need is, check and see whether or not they've been linked to a provider previously, and if not, if they need to be linked to one at that time, they're able to assess whether or not that person would go to a crisis assessment center or what additional linkages or resources may be needed to give that person the service that they need, because the goal is to prevent people from getting in crisis. So we want to give them sustainable long-term care and the assistance that they need so that they're not having to call 911 in a crisis situation.
Thank you, Captain. Chief, when you say expanding, does it expand citywide today or precinct by precinct?
It's going to go precinct by precinct. Number 12 is today, and we plan to have all the precincts online by the end of the year.
What would happen in the past when there was a mental health call or when officers arrived and someone presented that way?
I mean, we have well-trained officers. Even before CIT, we were doing twice as much training as most agencies in the state required. So we've always had an emphasis on ensuring that our officers were well-trained in the area of mental illness. But without the expertise that the CIT brings in the techniques for de-escalation. Oftentimes, you tried to wait out the circumstance. Sometimes, unfortunately, it resulted in arrests where people really needed treatment. But as we know, there's not a lot of resources available to law enforcement as it relates to mental illness. So this puts another major tool in the officer's toolbox.
Thank you, Chief.
Good morning, Chief.
Good morning.
98 members of the department who have been trained in CIT so far. In a case of a mental illness or crisis situation, are those officers available even if they're outside the precincts where they currently are now?
Absolutely, and that's one of the things that Director Reed Wilson is working on as well, is to ensure that we have recallability, that we schedule in such a way that we have officers available 24 hours, 7 days. And as we continue to grow the program, we won't have to be as strategic with making sure that the officers are on recall, because the goal would be to have the department trained at a level where each precinct on each shift would have a CIT trained person.
All right, thanks a lot.
All right. Any other questions? Well, thank you all for taking time out. This is a very important program, and as I stated, and as we've all stated, we are very excited about launching it, and we look forward to the results. Thank you.